Hi, this is Annie, and this is my presentation on Huntington's disease. This is a 16-year-old Caucasian boy who had a chief complaint of chronic tics and a worsening emotional state. His tics first appeared when he was 11 years old that manifested as coughing and constantly needing to clear his throat. His tics were persistent even though he was given medication, and 4 years later, or within the last year, his motor tics developed into or progressed into head and neck movements that he couldn't control. Also within the last year, he became very irritable and withdrawn. According to his mom, he spends most of his time alone, isolating himself from his friends and family. He was also having problems in school, concentrating, and his abilities to read, write, and calculate, those kind of skills, those cognitive skills, were also declining. The patient was alert and oriented. His vital signs were all within normal limits. However, he did show constrained gait and finger tremors. So the doctor suspected a genetic disorder despite not having a family history of it. And what he suspected was Huntington's disease, which is a very devastating genetic neurodegenerative disorder. A person's motor, cognitive, behavioral, and psychiatric symptoms, they just keep getting worse. It starts off from difficulty focusing, having poor judgment, being very irritable, even becoming depressed, and they just fidget a lot. They're clumsy, they're restless, they have trouble balancing, and all the way until they completely lose their ability to walk, talk, and swallow. Some of them may even stop recognizing even their own family members. So Huntington's disease disrupts the brain cells in the striatum and the cortex. There's actually mutation in the Huntington gene, the HTT gene. So the mutation will be the MHTT, and where the CAG part of the gene constantly repeats itself. It's called the expansion, and that leads to the protein malfunctioning and becoming toxic. And according to the Huntington Disease Society, there is no cure. Medication can help manage some of the symptoms, but it cannot slow down or stop the disease. This is just a visual graphic of the repeating mutated gene. As you can see here, CAG is constantly repeating itself, and it can repeat itself even more than 60 times. Now, Huntington disease is usually more common in adults, with first onset of symptoms being around 30 or 40 years old. There is a link showing that the more times that the CAG mutation repeats itself, meaning the higher the number, the younger that the onset of symptoms appear. So juvenile Huntington disease is not as common, but it does exist. So there is, the etiologies are, of course, oxidative stress, mitochondrial dysfunction, excitotoxicity, and transcriptional deregulation. All of these leads to the mutated gene. And here are the parts of the brain that are affected. As Huntington disease progresses, the brain starts to atrophy because different parts of the brain become affected and degenerate, and it's actually comparable to late-stage Alzheimer's. There are multiple mechanisms involved, and mitochondrial dysfunction is a key player, as it is in most other neurodegenerative diseases. So genetic testing was performed. There were 2 different parts of the test, and they did come out positive. It was then brought to light that the father side of the family did have a history of Huntington disease, but that was kept from the mother. So Huntington disease is a genetic disease, and mostly from the father's side. So summary of the case assessment. This is a 16-year-old who was presenting all three components, clinical manifestations of Huntington disease: motor, cognitive, and psychiatric. Multidisciplinary approach is needed, so a referral for several different doctors and practitioners are needed, from speech pathology, social worker, psychologist, and a neurologist. And for the nutritional intervention, sugar, gluten, and dairy are known to exacerbate neuroinflammation, which can be related to tics. So I would suggest that they avoid sugar, gluten, and dairy as much as possible. And of course, add in all the antioxidants and micronutrients to support mitochondrial dysfunction and to diminish all of the free radicals through fruits and vegetables. Stress management is a big one, because the more stress a person gets, the more tics they can appear, and that can be a very vicious cycle where especially a 16-year-old will feel very self-conscious and want to isolate himself more and contribute to more of his worsening emotional states. Some targeted antioxidant defenses that were shown in animal models to decrease free radicals and aggregates in the brain are creatine, vitamin C, CoQ10, DHA, and EPA. Now, as far as the different stages are concerned of Huntington disease, in the early stages, mood changes can lead to cravings for carbohydrates, simple sugars, which can further exacerbate the neuroinflammation and development of free radicals. So well-balanced, frequent, smaller meals are recommended. In the mid and even later stages, moist and soft foods are needed. So steam food before blending them to preserve nutrients as much as possible. Since he is a young teenager, he's youth, some of these foods might be more appealing to him. At the same time, can give him the caloric needs that most patients with Huntington disease are deficient in calories. They have problems with malnutrition because they are not able to swallow well. So full fat milkshakes, it could be non-dairy milkshakes, fruit vegetable mousses, mashed potatoes with butter, creamy soups and sauces, scrambled eggs, puddings, gelatins, lean meat cut into small pieces, mayonnaise, and full fat dressings. Thank you.